Welcome everyone. My name is Tess Clark and today I will be talking about the genetic condition achondroplasia. Achondroplasia is the most common form of dwarfism that causes a person's limbs to be short in length and disproportionate to their average size torso. This occurs because of an issue in endochondral ossification, which is the process of converting cartilage to bone in the long bones of the thigh and upper arms. This condition does not affect intelligence, and the average life expectancy is near normal. Achondroplasia has been linked to the fibroblast growth factor receptor 3 gene located on the short arm of chromosome 4. This gene codes for a protein that is important in the development of bones, controlling bone growth, and the ossification process. Achondroplasia is caused by a point mutation in which the amino acid glycine is substituted for arginine, interfering with proper gene function. Achondroplasia occurs at a frequency of 1 in 15,000 to 40,000 newborns, with approximately 250,000 cases worldwide. The condition affects men and women equally, and while there is no known race relation, it does appear more frequently in populations in Denmark and Latin America. Achondroplasia is inherited in an autosomal dominant pattern with complete penetrance, meaning that 100% of individuals with the mutation will express the expected phenotype. Individuals are born with this condition, and 80% of cases are caused by de novo mutations in the FGFR3 gene, which is one of the highest known rates of spontaneous mutation in the entire genome. Children of someone with achondroplasia have a 50% chance of inheriting the disorder. In the case that both parents have the condition, the child would have a 25% chance of not inheriting the disorder and a 25% chance of inheriting two mutated copies of the gene and therefore being homozygous for the condition. Homozygous achondroplasia is lethal and results in miscarriage or death shortly after birth. Signs of achondroplasia may be apparent through a prenatal ultrasound. Two common characteristics at this stage are an abnormally large head size and hydrocephalus, or water on the brain. Diagnosis can be confirmed through amniocentesis or at time of birth. Additional symptoms of achondroplasia include short limbs and fingers, macrocephaly, a prominent forehead known as frontal bossing, and mid-face retusion. Individuals with achondroplasia often have a curve in their spine, bowed legs, and experience frequent middle ear infections and sleep apnea due to constricted airways. There is currently no cure for achondroplasia. Treatment options include growth hormone therapy and extended limb lengthening. However, these come with their own risk of complications. Achondroplasia entails ongoing monitoring and management of complications, and surgery may be required for severe cases of bowed legs or if the curvature of the spine compresses the spinal cord. Another very important aspect of care for someone with achondroplasia is social and emotional support throughout life. Here are some examples of common characteristics of achondroplasia. While achondroplasia presents certain challenges, it is important to remember that the vast majority of individuals with the condition lead normal, happy lives, such as Game of Thrones actor Peter Dinklage. Thank you for taking the time to learn a little bit more about the genetic condition achondroplasia.